Okay.
I am welcoming Dr. Manish sir for the Health Medical Information Clear YouTube channel, and today we are going for live. And all the viewers, thank you for joining this meeting. And this particular video is we are speaking from Zoom call. The same Zoom is connected to YouTube. From the YouTube, it is telecasting today. And sir, today is World Women's Day, and I want you to congratulate for the women. Give some message from your side.
Thank you first of giving the opportunity. And today is a Women Day, and we celebrated since morning where how to make educate the women. And our this year's theme is women equality, and gender should be equality, and same of the women should be empowered of this particular the.
Wonderful, wonderful, sir.
uh,
Since
uh,
today is a Women's Day, and
uh,
we would like to talk about women and diabetes, the silent
uh,
threat you must know. That is the topic today. And
uh,
tell us how diabetes affects women differently than men.
That is a very good question. Yeah, everybody is knowing India is the capital of the diabetes. At presently, we are having the more than 130 millions diabetic patients, whatever. And unfortunately, of the undiagnosed of the diabetic is a similar of this particular the 10 to 11 of the crore. They are undiagnosed. We are not knowing either that they are diabetic or non-diabetic. Suppose they are coming with us, we are going to screening the camp. They are land up with the first time of the diabetes. And pre-diabetic population as well as same of the 110 million, they are pre-diabetic population. In 2025, they are saying out of three, 1% will be diabetic, a pre-diabetic, and undiagnosed diabetic. These are a big issue and big challenging of this particular. Just we are going to crossing our China. Still is a China number one. It is a China is a country is a capital of diabetic. After China, India stood second country, and third country is USA. And what about today? We are going to talk with the women and men. What about the today is a women international day? How to differ the women? Definitely now earlier men were more commonly susceptible to diabetic rather than the women. Now it is last of the couple of the years we are seeing of particular the lifestyle, junk food, and some hormonal changes, stress, tension, some of the other factor, polycystic ovary disease, obesity, kids obesity. Now is a going to diabetes is a burning issue. Not only men as well as women is also what about the and second part is a particular we are seeing of the kids obesity is a just the obesity is one of the trigger of the figure of the diabetic of the kids obesity we are seeing of the women of the teenage of the age of the 10, 12 of the baby particular girls they are having some of the polycystic ovary disease or polycystic ovary disease means it just say she is a pre-diabetic ultimately whenever she is going to grow and she is landed with the type 2 diabetes. So some of the different with this particular we will talk of the next couple of the questions why women is a differ from the man in diabetic. Now, statistical data is a equality to the men and women are equal as a incidence of the diabetic of the aspect.
Nice, nice, Dr. Manish sir. And I would like to discuss on what is the yearly reduction and prevention tips.
That is very good question. Definitely, all the non-communicative, not only diabetes, hypertension, cholesterol, obesity, all are lifestyle disease, whatever, all are lifestyle prevention of water. I'm talking of the preventive aspect of this particular. That is a diet, exercise, take less carbohydrate, particularly refined carbohydrate. We should take more complex carbohydrate. Walking is a must. Exercise, aerobic exercise of the these. So this can be preventive and early screening and early checking of the who are having the bad family history, obese, smoking, early age of the hypertension, some of the skin marks, just like I'm talking with the nigricans, they are more prone
Got
to
it.
the diabetes and they are having some of the strong family history. They should check the age of
Viewers are
18,
there.
yeah, 20. we should get the fasting blood sugar and postprandial blood sugar should be checked regularly.
Lovely, lovely, sir. And can you tell us this diabetes, what is the impact on the pregnancy and PCOS and menopause?
Oh, that very fantastic and huge subject. What about? And now we are seeing of the school going girls. Most of the out of the 10, 3 or 4 child are obese, or they are suffering with some of the polycystic ovary disease of the PCOD, and it is a just marker in it is a pre-diabetic condition. And ultimately, 25% once we are not going to treat properly diet, exercise, weight reductions, and give the metformin 850 milligram twice a day. Suppose we are not going to treat with the polycystic ovary disease, 25% of the this particular the girls can be landed with the some of the type 2 diabetes. So this is big issue, but it can be reversible once we are going to see once we are going to treat the polycystic ovary disease, diet, exercise. If the weight is more than BMI is more than 23, 25. Once we are keeping the weight in the tune of below the 23, and that can be reversible of this particular. Again, pregnancy in diabetic is a very big issue. Why earlier 1 year, 1 decade, that was often gynec, our friends, they were not knowing of the so much of the how to treat of the diabetes in pregnancy. Now we are seeing of the out of three, one female are suffering of the diabetic in pregnancy, and how to treat and how to tackle of the diabetic in pregnancy is very complex. What about the because of the drugs is not going to work of the diabetes in pregnancy, they need of insulin on how to titration of the insulin. We should educate all our friends of the who are going to treat of the antenatal care. And menopausal, you are saying right, whenever menopausal pregnancy, menopausal, and as the age of 40, 42, and 45, they are going to the menopause, and estrogen is going to withdraw. But estrogen is a protective, it is an insulin sensitizer. Whenever estrogen level is getting down, and insulin sensitizer levels are going insulin resistance, and most of the postmenopausal female, and particular obese, stress, tension, or who are hypothyroidism, they are developing and they are landed with the type 2 diabetes.
Lovely, lovely, sir. That was a very nice
Mm.
explanation. And
Mm.
what are the uncommon symptoms women tend to overlook?
Most of the diabetes is a very silent and chronic and inflammatory disease. Out of 10, 7 in the 7%, we are not having particular the typical symptoms of the polyuria, polydipsia, polyphasia. End of the day is some leg cramps, delay oozing. What about only 30% patient is having complaint with the typical of osmotic diarrhea, just osmotic symptoms of the polyuria, polydipsia, polyphasia. And what about female? In particular, most of our society are going to ignorance of these symptoms. Particular, they are not. They are not going to routinely check up to the doctor. Now scenario has been changed in the particular. I'm talking with the rural area, urban area. Is a age of 18, 20. They are going to the checkup with our GOPS gynae. They should get the fasting, postprandial blood sugar. If the fasting and postprandial blood sugar is high, and we should get the last 3 months of the HbA1c should be done. If the HbA1c is more than 6.5, and they are turned up the diabetes, type 2 diabetes. So these are some of the issue, and some of the patient is a complaining female of the urination and burning of the sensations of particular who are sexually actively, and they are going to doctor and gynae or urinary routine urine checkup will be done, and urine examination are showing of the excretion of the glucose +1, +2, and ultimately they are going to the check with the fasting and postprandial blood sugar. Or these are a routinely checkup by our corporate hospital of the any female coming with the urinary tract infection, and we are getting the urine check, or suppose urine contain the glucose +1, +2, +3, and we are getting confirmed by the blood examinations. So these are a common and detection of the diabetes in particular the women.
Dr. Manish sir, tell about that how PCOS and thyroid and menopause impact diabetes risk.
So that is very good question. What already I have discussed with the polycystic ovary disease, particular POC. It is what about the young teenage girl. At least once we are not going to treat, most of the obesity is a very root cause of the polycystic ovary disease. Once we are not going to treat the obesity of the some patient is having the BMI is more than 25, 30, they are huge obese, hypothyroidism, and they are having some of the polycystic ovary disease. Once we are not going to the lifestyle modification, weight reductions, tune of the 5%, 7%, 10% of the basic word, and full dose of the metformin 850 milligram twice a day, we can make reversible. Suppose we are not going to treat properly and we are not going to educate to them who are having the sum of the polycystic ovary disease. So 2 to 3 times they are more prone to the develop the type 2 diabetes every yearly. These are some of the issue. And again, I'm telling with the who are hypothyroidism, most of the hypothyroidism I'm seeing of this particular the across the world is a more common in female rather than the male in the tune of the 7:1. 7 is and they are having the polycystic ovary disease and delay the periods and irregularity, and 2 to 3 times more they develop the diabetic rather than the who are non-obese, non-hypothyroidism, and lean and thin of the women.
Wonderful, wonderful, Dr. Manish sir. And we go move for the next question. Diabetes and weight gain in women. What is the real cause?
Definitely we can say 2/3 of the diabetic patients they are obese. But our obesity is a different compared to our European and our Caucasian part. Our BMI is our body mass index is a so no it is not high compared to the European part. Suppose we are going, but we are more in particular visceral fat, and visceral fat is a more it is a responsible for the developing of the diabetic, what I am talking this particular. So I am telling is a diabetes rather than we should tell diobesity because of the 2/3 of the diabetic patient, they are obese, they are having the BMI more than 23, is a considered as a obese grade 1. If the BMI is more than 25, it is a considered as a obese 2, and BMI is more than 28 is a obesity third, and BMI is more than 30 is obese obese grade third, fourth. These are some of the grading of this particular. But unfortunately, our obesity is a different compared to our counterpart of the European. We are more in visceral fat. Fat is ectopic fat, fat as a myocardium, fat as a liver, fat as a kidney. They are more dangerous. And these fat are a pathogenic, and these fat are going to release the inflammatory marker, and our beta cells are going to damage, and insulin are going to decrease, and they are landed with the some of the type 2 diabetes of the. So 2/3 of the patient is a diabetic, they are obesity. And once we are going to treat the obesity of the we are keeping the BMI below 20, chance of the diabetes can be reversible with the diet, exercise, and some of the medications.
Lovely, lovely, Dr. Manish sir. Thanks for answering those questions. Now,
Uh,
the sugar and stress. How women can beat diabetes naturally?
oh, that is very good. Big person now is a
The in medical information clear, our channel goal is to make people healthy, make people that they should live free of diseases, and they should not go to doctor. They should live so healthy and fit. So give us some natural ideas that how can they can beat this diabetes naturally without any medicine.
definitely, you are saying right. Most of the diabetic patients, they have some of the stress and depressions of the big issue, and day by day we are going to some of the depression, stress are going to increasing, pollutions are going to increasing, and ultimately they are going to damage with your beta cells of this particular. And in stress and some of the depressions, some of the stress hormones are getting increased, just like epinephrine and non-epinephrine. and when your sugar is getting the high, but that can be stress, can anxiety, and some of the depression can be partial by some yoga, meditations, playing the sport. Yeah, swimming can be do. Walking is a must of the all the diabetic patients, because once you are going to walk of 40 or 45 minutes of the brisk walking, some of the good hormones, such as pleasure hormone, are getting released, and to relieve the some form extent to the stress also. So in the two-thirds of the diabetic patient I'm seeing in the form of the stress and depression are common.
Okay, okay. So, what are the good habits they should have?
It is walking, diet, exercise, regular checkup with your doctor should be, and who are obese, who are having the history of the family history of the father, mother, sibling of the diabetic, early age of the death. We should go regular checkup of the all the our guidelines of the RSDI guidelines. Age of 18, we can we can get the driving license, we can do the our voting rights. Why we should not get the age of 18? Should be check of our blood pressure, weight, and fasting blood sugar and postprandial blood sugar should be checked or age of 18 according to our guidelines.
Lovely, lovely. Now let's go into diet part. So, if the what are the foods that will increase the sugar level? What are the foods that will stabilize it?
That is very good. Most of the diabetes, 50% diabetes can be covered by the diet and exercise, and monitoring and education will be covered by the, and 50% patient will need some of the medication, like the oral medications, and some oral medications are getting failure. They need of the insulin. So we are saying some of the diet, and some of the study is showing north, east, south, west, where we are taking more carbohydrate. We are taking more wheat and
Hmm.
bread and
Okay.
bakery items. These are
Hmm.
responsible.
Okay.
Maida and what you call junk food and aerated drinks and cold drinks. I think we should change of our carb part. Carb, we should make of the not more than 50% carb, and we should take our complex carb rather than the refined carb. And we should take more of the fibers rather than the juices. We should take of vegetables, we should take of fruits rather than the juice, and good amount of the proteins. Protein should be around the 20 to 25% of our meal, and rest of the 20 to 25% should be energy from our fat. The saturated fat, it should not less than 7%, and omega 3, and mufa pupa should be rest of this particular. So this ideal, our diet habit, plate should not more than 9 inch. Half of the plate should be full of the vegetables, one-fourth of the proteins, and one-fourth of the this plate should be of the carb, and particular the complex carb and curd and what about. So these are, so we should sort our refined carb. We should take more proteins and moderate amount of fat.
Lovely, lovely. So the woman should take in a plate the 50% should be protein, and the 25% should be the vegetables and fruits, and another 25% should be the carb. So 25% should be
Carb,
carb.
and particular and carb should be a little complex carb rather than refined
Give
carb.
us some example on what is the complex carbs.
This is a complex carb. We can take of the multigrains of this particular the bajri, jaw, and that is a of the pulses of the mix of the sum of the more than 2 grains is a multigrains is a complex carb of the rather than the maida bakery items is a refined carb. This is simple carb. The complex carb contains a lot of fibers, and blood sugar is not going to the sudden spike to the postprandial blood sugar. Suppose we are taking the simple carb, after the 1 hour we are check the blood sugar is immediately increase of the level of 200, 300 of the. So we should avoid the bakery items.
Okay. So, Dr. Manish, in a personal question, when you started your practice as a diabetologist and today, What is the change you are seeing? How many patients that time was there? How many patients today is there? Tell us from your personal experiences.
That is very big challenging. India is a tsunami of the diabetes. I'm practicing more than 20 years, and 20 years, at least 2 decades earlier, that was a scenario of the kids are coming with the parents, they are having the diabetic. Now is a scenario has been reversed. Parents are coming with the kids, they are having the diabetic. Diabetic become more younger to younger. Now we are seeing of the diabetic is age of 20 to 30. Suppose I am seeing of the patient per day 25 to 30% of the diabetic. And out of 30, 20 were 20 are a diabetic, they are a first time below the age of 30. That is a worsening because we are seeing more younger to younger population because of the junk food, stress, tension, other comorbid conditions. Or these are big challenging for of the us. Suppose patient is having a 23 or 25 of the bank manager, sitting job, IT sectors, of the obesity, stress, tension, or they are having the fasting blood sugar more than 200 and postprandial blood sugar is near to 400. HbA1c last 3 months of the HbA1c having the 11.3 and patient asymptomatically, the doctor, saab, I am comfortable. Why my blood sugar is high? And we are taking the history, your family, father, mother, sibling, we, dada, kaka, nana, grandmother, they are having the diabetes. We should make of the check of the routine. But these are worsening. Now diabetes become more younger to younger, and diabetes does not come alone. Always I'm telling all the my patient is a B, C, D, E. Diabetes is a two-thirds of the diabetic patient, they are having the hypertensive, two-thirds of the diabetic patient, they are having the complications of the cholesterol, dyslipidemia, two-thirds of the diabetic patient is having some of the eye problem, urinary tract problem, dyslipidemia. Some of the patient is having the problem of the heart problem. These are some of the burdening issue. We are seeing of the sudden cardiac death in of the younger populations in the 30 to 40 years. They are doing the gym and everything, and we are seeing of the sudden death because of one of the possible reason is a diabetes, and diabetes is a silent killer, and we have to treat of the younger populations who are young, who are pre-diabetic populations, who are having the family history of the we should treat them and we should educate.
Thank you, sir. And can you say today's scenario in pregnancy woman getting diabetes that affect the child and the baby, and what are the risks associated with in the diabetes management during the pregnancy, and what are the diet, exercise, and post pregnancy care you are suggesting?
Definitely, that is very big subject, a big challenging. Already I have discussed out of three, one female is a developing of the diabetes in pregnancy, particular the second trimester, end of the second trimester of the we should get the antenatal checkup every monthly. They should get the fasting blood sugar, postpartum blood sugar, along with the some of the CBC, hemogram, and urinary should be checked. Who are having the late marriages or who are having the strong family history, we should get the every monthly of the fasting and postpartum blood sugar. Suppose we are not a proper treat of the diabetes in pregnancy, these are very bad complications of the stillbirth, some of the fetal defect, some of the congenital anomalies, macrosomia, and some of the other issue, hypertensive. And these are some of the issue in particular the so first or in the diabetes in pregnancy, only insulin is a very safe and a 24-week. Most of the female are coming with the antenatal cares to the option gynae, or we are going to check with the fasting and postpartum blood sugar, and they are having the more than 200 fasting and postpartum is 350, HbA1c is 9.5, and they are going to refer to the diabetologist we are going to initiate diet, exercise, less carbohydrate with a good amount of protein, with a good amount of the fat, metformin is a second line of the treatment, and insulin, or we are going to initiation of the insulin is injectable, and we are educate you have to take the insulin because of the we have to control your blood sugar. We should keep the fasting blood sugar is a 95 milligram deciliter in pregnancy in diabetes, and postpartum blood sugar after the 2 hours we should keep the 120 milligram deciliter. Later, once the antenatal get the by and this would check as most and 25 that is who they can the treatment of type 2 diabetes.
Yes, sir. Thank you so much for giving us. And one last thing, ask you. This is the last question to ask you. What is the reversing and long-term health?
What about I think that we have to regular checkup, regular screening, regular walk, diet portions. Already I have given the mantra of the plate should not more than 9 inch. Half of the plates should be full of the fibers. 1/4 is a protein and 1/4 is a carb with the and we should take of the more pulses of the milk and milk product and pulses and dalen, and who are non-vegetarian, they can take the boiled egg and fish can be taken with the small portions, and fiber should be taken more and routinely uh, Indians typical we are having a sarcopenia, we are less protein and we are more visceral fat and we are taking less fibers, and averagely Indian they calculated of the all the guidelines we are taking not more than 20 to 25 gram per day of the fiber. Suppose my weight is 70 kg, I should take of the 70 gram of the fibers. So that is a some of the thumb rule. We should take more fibers, more fruits, less bakery item, less maida, and we should celebrate all our festival and cutting the watermelon, cutting the fruit cake rather than the bakery cake.
Nice.
And walking is a compulsory, and everybody should go walk of the 10,000 steps per day is a to avoid the diabetic and decrease the chance of the diabetic.
Wonderful, wonderful, sir. And I would like to thank Dr. Manish Agarwal, sir, MBBS, MD Medicine, and Diabetologist, FACP from USA, Diploma in Endocrinology, and I also thank from you, all your team from Medilink Hospital from Ahmedabad, and thank you so much for coming here and sharing your wisdom with us. And we look forward to hear more from you, sir. And thank you for spending
Thank,
time with us. And do
thank you
share
once
your
again. Thank you.
yes, sir.
Uh,
And really, it was a nice experience. The viewers, for the viewers, it will be a very useful one. And we will come up with a new videos, new topics soon. Thank you so much, sir.
okay, okay, thank you. Okay,
Thank
bye.
you. Thank
Okay,
you.
bye.